task of cleaning your blood. The bean-shaped organs near the middle of your back process about 200 quarts of blood every day, sifting out toxins, waste products, and extra water in the form of urine. In people with chronic kidney disease, the kidneys slowly lose their ability to remove waste and regulate the balance of fluid and minerals in the blood. Kidneys also normally influence red blood cell production and vitamin D activation. Without treatment, complications can include anemia, bone disease, and progressive kidney disease. According to the National Kidney Foundation, 20 million Americans have chronic kidney disease, and 20 million more are at an increased risk. Most don't even know it.
Chronic kidney disease, or patients with chronic kidney disease, may not have any signs or symptoms in the early stages. And that means people with chronic kidney disease are not thinking about it because there's nothing to tell them that they have a problem.
The two most common causes of kidney disease are diabetes and high blood pressure. People with a family history of kidney disease also have an increased risk, as do African Americans, Hispanics, Native Americans, and Asian or Pacific Islanders. If you have any of these risk factors, you should be evaluated for chronic kidney disease. Your doctor should check your blood pressure, test your urine for protein, and take a blood test to measure kidney function. These tests will help determine how well your kidneys are functioning.
One of the main functions of the kidney is to filter a lot of the toxins and byproducts that cells make in the body. And one of these is called creatinine. And creatinine is important because not only does the kidney filter this, but this is a test that is very easy to do in the lab. So we commonly measure creatinine. And by measuring creatinine, and then also checking that with a person's age, their gender, and ethnicity, we can actually calculate how well their kidneys are filtering. And that calculation is called the glomerular filtration rate.
As kidney disease progresses, people may notice symptoms such as fatigue, poor appetite, trouble sleeping, dry, itchy skin, muscle cramping, or increased urination, especially at night. But remember, these symptoms usually don't appear until the later stages of kidney disease. To classify the stages of kidney disease, doctors use a set of guidelines called the Kidney Disease Outcomes Quality Initiative, or KDOQI. In stage 1, the kidneys still function at greater than 90%. This drops to between 60 and 89% in stage 2 and 30 to 59% in stage 3. In stage 4, patients have only 15 to 29% of their kidney function left. Stage 5 is complete kidney failure, meaning the patient must undergo dialysis or receive a kidney transplant to stay alive. The good news is that early detection and treatment can often slow the progression of chronic kidney disease and prevent complications. Treatment may include lifestyle changes, such as exercise and special diets, as well as medications.
The therapy for chronic kidney disease is very individualized. So it's important that a patient meet with their doctor, and their doctor will make an assessment as to what is the best treatment for them. One of the most important components of treatment is controlling blood pressure for most people with kidney disease, because most people with kidney disease have high blood pressure.
A common complication of kidney disease is anemia, an unusually low red blood cell count. Ailing kidneys tend to produce insufficient amounts of erythropoietin, or EPO, a hormone that stimulates red blood cell production. Fortunately, this type of anemia can be treated with a synthetic form of EPO along with iron supplements. Another potential complication is bone disease. When kidney function begins to fail, active vitamin D levels begin to decline. This triggers a cascade of events which leads to a condition called secondary hyperparathyroidism. Without active vitamin D, the parathyroid gland becomes overactive, producing too much parathyroid hormone, which in turn pulls calcium from your bones, eventually leaving them weak and brittle. But if kidney disease is identified early, patients will be able to have their parathyroid hormone levels checked and begin appropriate treatments to manage their condition. This may require meeting with a dietitian and taking a prescription form of vitamin D.
Importantly, the vitamin D that we eat, either in our foods or if we take vitamin supplements, it gets converted by the kidney into the active form of vitamin D. It's the active form of vitamin D that really does all the work and is really the important form for helping keep us healthy. So if the kidneys are diseased and not functioning well, it cannot turn vitamin D into the active